Okay, we are live. Hi everyone. How's your Sunday going? Let us know in the comments below. And soon we'll be starting with a very interesting discussion. As you have noticed from the title of today's workshop, we'll be talking about something that is not talked about too often. There's a lot of myths around it. There's a lot of misinformation around it. So we have a special guest today who will be talking through the workshop with us. But before we get started, just waiting for a few more people to join in and let us know in the comments how your Sunday is going. Did you have a cheat day today, or did you follow your healthy diet today as well? And overall, how your weekend has been. So let us know in the comments, and we'll start in about a minute or so. Just waiting for a couple of more people to join us. But those of who you all don't know me, I'm Snehal. I've been living with type 1 diabetes in the last 23 years. And yes, we have a special guest today, like I said, Jaya. I'll let her introduce herself. Jaya, over to you. Yeah,
Yeah. Hi, Snail. You look gorgeous. Let me start with that.
thank you.
Thank you, Blue Circle Foundation, for having me here. I'm Jaya Jairam. I I cope with a different type of a problem. I am a kidney transplant recipient of 15 years. And about 8 years ago, I joined the Mohan Foundation. Mohan is actually an acronym for Multi Organ Harvesting Aid Network, and what we do essentially is raise a lot of awareness about organ donation and transplantation. Mohan Foundation is an NGO. It's a 28-year-old NGO, so I am a relatively new kid on the block. But I feel very passionately about this because having been through kidney failure and thereafter having received a kidney transplant, it's something very close to my heart. Uh, where it's our mission to raise awareness about organ donation so that every Indian coping with end stage organ failure need not have to, you know, that struggle can come to an end if the person is able to get a life saving organ in time. But not many people know about what is the process, how do we go about it. They don't even know that there's such a thing that they can commit to. So this is what we do to a lot of awareness around organ donation. We also work with government hospitals because we realize that just raising public awareness alone is not sufficient, because when a family says, hey, I want to donate the organs of my loved one, the entire hospital setup, the ecosystem must also be geared up to enable that, to facilitate that. Putting in place the various ecosystems, because this organ donation transplantation is a relatively newer program in the country for India. And this is going to take a lot of center stage. So that's just broadly about me. I feel extremely privileged and grateful to God that I've been able to receive this life saving gift from a loved one. And today's actually it's my mother who donated one of her kidneys to me, especially on Mother's Day. This is, I think, there's this huge but this the webinar is happening at the right time, and I'm so grateful that it's such a special webinar today, and I can, call it like a tribute to my mom.
Absolutely.
That's broadly about me. I know I've given a huge introduction about me, but over to you, Sunil.
No, no, no. I think that was a good gist of what we are going to talk about in today's workshop. And, like your personal story, I'm sure it's going to be an inspiration to everyone who's joining in and listening in as well. But more onto that, because you touched base upon your story. So we want to know about you, like what was the condition that you are having, and why did you need a kidney transplant, and how did it go about?
So, well, why I ended up with kidney failure is something that I still don't know, and I've stopped thinking about it. So, invariably, in a lot of the cases that I now come across, people say that वजह पता नहीं था कि किस वजह से kidney fail हुआ. So it is in fact called as a silent tsunami, because when it hits you, it's invariably too late, and it's just silently creeps up on you. Outwardly, everything looks fine, but till it reaches the end stage. So kidney failure happens in multiple stages, and there are about 4 or 5 stages of kidney failure. And if it is in the initial stages, and if it has been detected well in time, then it's good, because you can actually manage the condition and live with it in a near normal way. But if you haven't found it out till it reaches the end stage, then there's really nothing much that you can do in terms of managing the and living with the kidney failure. So that's what happened in my case. This happened in 2000, uh, 2008. I was losing weight, and it was kind of unexplained, but I was happy that I'm losing weight.
Yeah. And
But I didn't.
that's one of the things, what India is like, losing weight is always taken as a good sign, and no one actually bothers to check in ki andar kya ho raha hai, like it may not always be a good sign, maybe something is wrong within your body. That's a message I want to give to everyone. And also it's important, because like diabetes is so related, like interrelated with kidneys, because I think kidneys are one of the first organs that are impacted because of uncontrolled diabetes. So I'm sure a lot of people, if there's any questions for everyone, just put them in the comments below, and we'll definitely take them at the end of the session. We'll have an open Q&A as well. But yeah, Cha, over to you. Continue.
So, coming back to this, that there was unexplained weight loss. I was becoming anemic, and I was just 33, 34. तो हम लोग ये annual checkups वगैरह we start thinking after certain
Yeah.
age, say 40 or so. You don't think at the age of 30 anything can happen to you. um, but I mean, it's alarming. It can happen even in kids. That's what, after getting into this field, I realized that it's really important that even if you have kids, get annual checkups done. It hardly takes a prick and a vial of blood to get it checked, but no harm in staying ahead. Because yeah, so coming back, I was 34 at that time, and that's when, so there were these series of things happening, all unconnected symptoms. I never really connected them all to something so huge and so major as kidney failure. But when I went in for a complete checkup early 2009, that is when I found that my creatinine, which is a measure of kidney function, it was elevated. It was at around 3.5, whereas a normal level should be less than 1. So that was worrisome, and then the doctors told me, you need to rush, go meet a nephrologist. Now, I'd never ever heard of a nephrologist, and I didn't even know what they do, what is their specialty. But having been pushed into it, then that whole silsila of frequent visits, getting checkups done, getting biopsy done. And then the first biopsy that we got it done, the doctors confirmed that it is not acute failure, as in it cannot be reversed. It is chronic failure, which means it's a permanent damage.
Mm.
um, we were in, not just me, my entire family, we were in denial कि ये ऐसे कैसे हो सकता है. I had led a very ordinary life, Snehal, and never in my wildest dreams had I ever imagined something like this. And there were no reasons leading up to that as well. I was a very padaku bacha and acha bacha, so no habits and all also. So really, it was a big. It kind of confused us to no end. But then, okay, we went in for second opinion and one more biopsy done of the kidney, and it was concluded that no, it is whatever be the cause. Now, as of now, you are in end stage kidney failure, which means the kidneys are functioning less than about, say, 10 to 12%. So it just hit us, but ठीक है, we accepted it, and we had to look at the way ahead. So, in short, I still don't know what caused my kidney failure. Over to you, Sneha.
Yeah. And it comes as a shock to me because always when you talk about kidney failures or any organ failures, there's always this, there has to be some reason, like that's the first thing that we rush towards finding कि क्या हुआ, क्यों हुआ, मैंने क्या गलत कर दिया, and more often than not we have always like led, like normal lives, like no addiction to any abusive substances or anything, but in spite of that things can go wrong, and like you said, just want to highlight it one more time that always do your annual checkup. Our community here is, like is quite, like in the zone of like we always get our annual checkups done because of different types of diabetes and the conditions that we're living with. But obviously then kidney is also an important part, like you said. Creatinine is always there, the lipid profile is there. So an yearly annual reminder for everyone who's joining in, if you have not done your annual checkup this year, it's time now. Take it up. And also like another trick that I usually do is, like I do all my checkups on my birthday, or around my birthday, because then there's no way I'm going to forget it. And it's like an easy, it's like a gift to myself, a healthy gift to myself. So that's
That's a
one trick
smart
that you
way.
that's a smart way. मतलब reason नहीं होना चाहिए कि मैं भूल गई, or I missed it, something like that. So that is one thing that that's a reminder for everyone, And I'm sure, like you said, there was a lot of confusion around the diagnosis, like the denial. And after that, like once you realize that you are going to need like a kidney transplant, so what was the process like? Like you talked about, like the process is quite new in India. So can you just highlight a little bit about that?
So, Snehal, when somebody is told that uh, you're suffering from kidney failure, and so one needs to check whether it can be reversed or not. So that's why they do biopsies, because biopsies are most conclusive. There are some new gen biopsy methods, like liquid biopsy and all, which are non-invasive as well. So I would, urge each one of you, if you are considering something like that, do explore this option because it's non-invasive. Because biopsies are generally invasive. That's all I'll say. And it's obviously any invasive process is not easy, but nevertheless. So biopsies can give a conclusive way of going ahead, and on that basis, well, the doctors can also decide as to what stage of kidney failure is. So there are calculations, depending on the glomerulofiltration rate of the kidney, and they are able to then tell you as to what level of functioning the kidney is in. Accordingly, then they tell you which stage of kidney failure it is in. So, if it is first stage, second stage, third stage, it can be managed. First stage is really, you've got it really early, excellent. Just there are minor precautions that you need to follow, and you need to keep doing your checkups. Just wait and watch, sort of a thing. For second, third failure level stages, of course, there will be some sort of medications and all that you'll be put on, diet restrictions and all. Fourth, of course, you need to be fairly alert. There'll be more diet restrictions, because when you have a kidney that's impaired, it's not able to do its functions clearly, and therefore you can't load it as you one would normally do. I mean, normally we lead such a carefree life. We don't think about these things, but when coping with such a thing, then there are a lot of do's and don'ts that come into play. Of course, when someone reaches end stage or stage 5, it's a very big challenge, because now you are looking at how well is your body able to cope. And when the creatinine reaches around 6 or 7, the doctors might then tell people that you need to start preparing for dialysis as an option. So then you have two types of dialysis: peritoneal dialysis and hemodialysis. So I would urge people to read up about this more, because two dialysis methods are very different. One requires you to be extremely proactive and manage your own life. You can do it by yourself also. And the other one, hemodialysis, of course, requires you to go to a center, get the dialysis done, and come back. So these are two very different ways, but not many people are aware. Unfortunately, not many doctors also share this option, because I always feel that as people who are coping with certain challenges in life, we should be given the option of deciding
Yeah.
which methodology of treatment suits our lifestyle and our life goals. So unfortunately, people are not necessary that everybody is given such options. So Please read up about it on the net. Reach out to us. We are happy to guide you. Reach out to me. I'm more than happy to guide you all. So these are the two types of dialysis broadly. And of course, a kidney transplant offers an option of a reset button. It's liberating. It's because when you don't have a functional kidney, only through a transplant you can put inside a functional kidney. Okay, but putting in a new foreign object inside a body obviously requires management of that. So there are some medications post op that you need to take lifelong. But otherwise, broadly for me, this was the process that when my creatinine from 3.5, when it got detected, when it crossed 6, the doctor said, hey, get prepared for dialysis. And hemodialysis is what they said. So I had my grudge with my doctor at that point in time, that why had he not given me the option of peritoneal dialysis and the kidney transplant, because I should have the option to decide. So this is why I spoke about the options. But yeah, if someone's talking about a hemodialysis, then they will be told to put in place a fistula. Fistula is where an artery and a vein, it's a small surgery, artery and the vein are kind of combined to form a bigger a vessel sort of a thing, and the dialysis can, it is then used as a site for the dialysis, hemodialysis. So this is something that the doctors will ask the person to get ready with, and then the person has to be started on dialysis. But in my case, I was stupid, I was silly. I resisted dialysis. I don't have any fistulas done. I just told the doctors that I don't want a dialysis because I'm afraid of it, and I don't want a lifelong reminder of this phase in life. So, in hindsight, it was utter foolishness, because when you don't have a functional kidney inside of you, dialysis is the only way in which you're doing a laundry job. So the kidney performs so many important functions, and one of them being clearing the body of its toxins. And when you don't have a functional kidney, you have to go outside. So dialysis is also called as artificial kidney sort of a thing. You know, where you go
Yeah.
to a machine, go to a center, the blood goes out of the body, it gets cleaned, it is put back. Now we take our body for granted so much that we don't even realize that this is, the kidney is doing 24/7. All our organs are doing their job 24/7. But you only realize the value of it when it stops working, and it makes you, it's a, like a rude reminder of how grateful we should be for just having a normal life. So this is essentially what the kidney does. If anyone should find themselves unfortunately in such a position, go ahead, get a dialysis done till such time as you can get a transplant. Now for kidney transplant, again, now kidney can be obtained in two ways. So first is a donor. So obtaining a kidney is the biggest challenge today, because kidney failure is so rampant in the country. And one of the main causes, the two of the main causes of kidney failure is uncontrolled diabetes and hypertension. Two of the most common lifestyle diseases that we are dealing with in the country, in India. So we are seeing, especially in pockets of the country where diabetes incidence is high, we're also seeing the incidence of high kidney failure amongst the population. It doesn't look at the age, it just attacks anybody who is across the ages, across genders. So this is something that I'm sure your community works a lot on, fitness, being mindful, and all of that. But please know at the back of your mind that today diabetes is one of the biggest causes for kidney failure, and it is a silent thing which creeps up on you.
Yeah.
So, when you're facing a kidney transplant, uh, remember that there can be two types of donors, either a living donor or a deceased donor. Deceased, as in somebody who has passed away and due to brain death. So, I'm going to touch upon this brain death concept. It's a new concept, but for now, just remember that somebody who is living can donate. God has given us two kidneys, so one of the kidneys can be donated by a willing person who wants to donate one of the kidneys, and the other option is to get it from a brain dead deceased donor. So whatever be it, if you have somebody who is willing to donate, like in my case, um, I'm very lucky because my entire family, they volunteered when we spoke about transplant with my doctor, and the doctor said that, do you have somebody in the family who is considering, who would consider donating, and my whole family stood up with me, and my mother said that I'm there to donate, so don't worry at all. Um, so look, I mean, invariably our family members step up simply because they can't watch us suffer. Dialysis is not easy. Coping with a impaired kidney is not easy with the diet, with the fluid. Hats off to those who manage it really well while on dialysis. I mean, I know so many who balance dialysis and jobs. Yeah, it's hats off to them. So the thing that I'm trying to say is that if most of the times there is a loved one who steps forth and says that, hey, I'm willing to donate one of my kidneys, in which case walk into the transplant center. Invariably, it's the nephrologist who gets involved at this stage. Transplant center is a hospital that does kidney transplants. So, and on our website, we've listed out the transplant centers. So, look out for your city close by to you. Look out for a good transplant center. Walk into the hospital. Go see a nephrologist. They'll write down a whole lot of tests and assess you first. And if a kidney transplant can help you, then talk about this donor who is within your family who is willing to donate. They will then check for compatibility. If yes, there is blood compatibility and tissue type compatibility, then the donor can donate one of their kidneys. There are a lot of legal processes also involved at this stage, because once the match is established, secondly, the donor's fitness has to be established, because now here is a person who is otherwise a very healthy person and who is willing to go under the knife for us, but they have to be completely fit, and this is what the doctors check out. Medical fitness is at most important. The person has to be an adult, and there cannot be any force or coercion in this case. So these are the verifications that are put in place. So there is a legal approval process. Once that comes in, then you're ready to go for a transplant. Invariably, the transplant surgeries happen in your next to next operating theater. So there is a donor team and a recipient team. The kidney is retrieved from the donor and immediately put into the recipient. So and the outcomes are excellent. With greater with higher generation medications, immunosuppressions coming up, the longevity of transplants is very high. We're seeing very good success rates, and India has some of the best healthcare systems when it comes to organ donation and transplantation. So it's well understood program by now. So this is when you have a donor within the family. But if you don't have a fit donor within the family, if, i.e., someone is wanting to give but they are not fit enough to donate, or there is just nobody in your family who is wanting to give. In such a situation, you have no other option but to walk into the hospital and talk to the doctors and put yourself on a waiting list. Now, this waiting list is a state wise waiting list. It's a registry of all those people who are waiting to receive a kidney transplant. And I'm sorry to share with you that it's a long list. Every state has a really long list, because that those many people suffer from end stage kidney failure and are wanting to go in for a transplant. So then you have to wait, because you wait for some stranger who has died due to brain death, and the family has said yes to organ donation. In such cases, such a donor's organs such as the heart, lungs, liver, kidneys, pancreas. All of these can be donated. So that way, one of the kidneys is then allocated to you when it's your turn. It could be 2 years, it could be 3 years, it could be 5 years, 7 years, depending on your blood type, and it has to match with the donor. So it could be a long wait, it could be immediate, depends on the blood type and so many other conditions. So broadly, this is it. Um, a living donor and a deceased donor. Deceased donor waiting list is longer. This is why we are seeing a lot more family members offering to donate, and so that they can pull their loved one out of the misery. So this is broadly the process of transplantation. How to
Thank you,
register, what
Jaya. Yeah. I think that was quite insightful because I didn't know a lot of these things that you mentioned, and I'm sure a lot of our audience also is not aware of this. So thank you for highlighting that. And in the comments, we have put in all the details of Mohan Foundation. So if you want to know anything more or want to learn about their work, please feel free to go on their website and use the helpline as well. But yeah, I think kudos to your mother, because I'm sure that decision also, just to give or donate a organ from your body to your loved one, this is also quite, like you have to think a lot, and then you have to, like you said, you have to take care of your physical well-being also. So were there certain things that your mother was, like required to do before the transplant or after the transplant? How was it for the donor in this case?
So, Snehal, you will be surprised to know that for me, for mummy, it was, I think, a no brainer. She had made up her mind. It was purely emotional process. She had just made up her mind and she had decided, I'm going to give one of my kidneys to my daughter. That's it, period. Khatam. Now, the dilemma and the confusion and the fear is what came in my mind, not really hers. She was very clear. And when she had taken that decision, I think she had made peace with that decision. But it was me who kept delaying this decision for about 3 to 4 months. I was very confused. Am I doing the right thing? Am I putting my mom to risk? Because mom was 60 at that time. I really didn't, 60 is an age when you start thinking, okay, mommy, I should be taking care of my mom. It should not be the other way around that um, I'm putting her under such a huge risk. And any surgery, especially major
Yeah,
surgery, is a risk, of course. So there was a lot of confusion, to be honest. And I wish there were more support groups at that point in time, because today we have support groups, and at Mohan Foundation, I myself lead a support group called Transplant Recipients of India and Organ Failure Patients, a movement to provide hope. So it's called Triumph. Okay, so but I wish back then there were more such support groups where I could have met somebody in flesh and blood. I could have met a donor. I could have met a recipient, just to find out and to hear their experiences
yeah,
and learn from them. So it was all the more confusing at that time. But yeah, for my mom, luckily, touch wood, she has no such health issues, and she at that time also she was leading a medically fit life, no health issues whatsoever. So for the doctors also, they were very encouraged with that when mom stepped forth, and I was the one who kept delaying it. But I did meet somebody, it's a they say ना कि हम लाइफ में भटकते रहते हैं at such dark moments when there's absolute confusion, because I also had a my daughter was a 5.5 year old at that time, and such dark thoughts come to your mind when you're suffering such a critical illness. And I really didn't have the clarity at one point in time whether I'd be able to watch my daughter grow into a teenager, and then grow up to get married, grow up to get a job and all that. But there was a very big question mark at that point in time. It was very confusing. So anyway, so coming back, for my mom, yes, as long as the medical fitness was there and mentally she was absolutely prepared. Of course, the so there are interviews which are conducted at a legal during the legal step, in which They verify that there is no coercion on the donor. The donor is aware of what they are getting into. Is it an informed consent? So all of these verifications are done at that point in time. And Mom was fairly clear once she had made up her mind. So it was kind of a smoother process for us. Of course, she went her head to toe, each and every part of her body was checked as part of the medical fitness, and only every after getting complete clearance on each and every aspect could we go ahead.
That's
But
good.
touch wood, it's been 15 years and everything is fine. So
No,
actually,
no,
I'm
that's
here at my parents' place to celebrate
yes.
Mother's Day with my mom.
Yes, yes. So, like I said, like kudos to your mother and all the mothers, because we know, like even for diabetes and especially for kids on insulin, it's so difficult, and the whole charge of the management of the condition is on the mothers. Like a lot of comments here are also saying, like Happy Mother's Day. So, kudos to all the moms out there, and like like giving us that strength and support and love to keep on going, and even when we're living with the chronic conditions, like that. But yeah, you also touched base a little bit on the post-transplant care. So can you highlight a little bit on that?
Yeah. So now, whenever someone undergoes a transplant, before coming to post-transplant care, I also wanted to talk to you about there are people living with who used to be living with diabetes and who couldn't manage that, or it was kind of not, it was untenable, and the doctors then advised them combined pancreatic and liver
Hmm.
transplants. That is also possible. People also undergo pancreatic transplants as well. So there's a lot of things. It's a fairly advanced uh, program in India. You have kidney transplant, you have liver transplants, you have pancreatic transplants, you have combined pancreatic and kidney, combined liver pancreatic kidney. So I guess there here is a time when you can get almost all your uh, organs replaced and still lead a normal life. So thank God we are in this age and generation where we are able to get access to these things. Yeah. So coming to post-transplant life, let me tell you, it's liberating because you can travel, because you can resume work. um, no restrictions as such, only hygiene, and that too I'll tell you why. So when a foreign body is put inside our body, simple, just like आँख में कचरा चला जाता है, dust चली जाती है, तो body's reaction is the eye start watering and it tries to wash the external object out, right? और सपोज वी गेट अ बैक्टीरियल इन्फेक्शन और वायरल इन्फेक्शन, तो बैक्टीरिया वायरस अंदर चला गया तो बॉडीज रिएक्शन इज टू वी गेट फीवर, जो अपने वाइट ब्लड कॉर्पसल्स है वैसे फाइट इट एंड ट्राई टू रिमूव इट. सेम वे व्हेन an external organ like a kidney or a pancreas or a liver is put inside the body, its reaction is to reject it and remove it outside the body. So, to prevent that, the body is pumped with medications called immunosuppressants. It suppresses the immunity of the body so that the body does not recognize the transplanted organ as a foreign object. So, in simple words, this is what it is. So, generally, as part of the post transplant medication, we are given immunosuppressants, and generally, it's a there's something called as tacrolimus and something called as mycophenolate mofetil. Generally, it's a combination of these two, plus a steroid, which is steroid is for suppressing infections inside the body. That's also minimum dose of steroid will be given, but this is generally given lifelong. Okay, but the way to look at these is they are our friends. They are the ones who help us retain our organ and nurture our organ and lead a normal life. So, because we are immunocompromised, we have to protect ourselves from infections, catching
Yeah.
infections. Especially COVID was a difficult time for us, for many, I would say, but especially because we are in the immunosuppressed category, it was difficult. It was more so mentally very taxing. But other than that, yeah, whenever I go to go to a hospital or to a crowded place, I wear a mask. But especially in the initial 3 months after the surgery, because the immunosuppression doses are extremely high, uh, the recipient will be asked to isolate themselves, i.e., be inside the house in a more protected environment, and not expose yourself to external risks or things like that. But after 3 months, generally, all the recipients are asked to resume work. I was very afraid to resume work and go outside. I was very afraid to take that first trip outside of, first vacation trip. But my doctor asked me one question: Jaya, why did you have this transplant? I said, to lead a normal life. He said, then why aren't you leading a normal life? Go lead a normal life. Travel. Have your chutti, have your vacation. Just take care of your, जो precautions है वो संभालना है.
Yes.
Especially with hygiene bit. So I never eat anything raw outside because you can catch an
Yeah.
infection through that. I always make sure that it's freshly prepared food. I always request the chef wherever I go कि भाई थोड़ा ये गर्मा गर्म बना के दे दो. I avoid eating raw stuff. Soups, anything hot that is served
Mm.
is perfectly fine. Also, water, bottled waters, distilleries, they are safer to have, or boiled water is perfectly fine. Um, yeah, broadly this. And if someone's coughing, sneezing, I tell them, please stay away, 6 feet away. So
Yeah.
these are all the precautions that I take, but it's not such a big deal. So life is good after a transplant. Just some teeny weeny precautions to be taken, especially the first year is very crucial. You have to take extra care of yourself. But otherwise, life is good.
I absolutely love Jaya the way you have like showing talking about this in a very positive light, because
Yes.
this kind of conditions, are like always crowded with, like confusion, there's chaos, there's a lot of, like unsolicited advice from, like everyone, and like ye mat karo,
Yes.
wo mat karo, this is so bad, so I
Tell me
really
about
like.
that.
Yes, I really like the way you talk about it so positively, and then yes, obviously, like you said, it's a big decision, it's a big surgery, and then you obviously have to take care like post transplant also, and then that goes lifelong. And you also talked a little bit about, like you can do like a combined transplant of kidney and pancreas. So we have one of our community members, Shekhar, and he has written a beautiful blog as well. So I'll put it in the comments here if anyone wants to go and read on that. So you can take notes from his experience and how it has been for him as well. Also, Jaya, like I know, like you have like talked very positively, and like you have explained it very nicely. But I'm sure at that time, like there would have been a lot of confusion, a lot of, like you said, like questions and like self doubt. So how did you feel emotionally, and like did you like take counseling or therapy or something of that sort?
Um, it was certainly not easy, especially until I got my transplant done. It was the most difficult phase in life, I would say. I never, most of us never expect such things, and the why me, and at such a young age, such a huge thing at such a young age, why me thing bugged me a lot. Also, not knowing what really caused it really bothered me a lot. To the point that I kept asking the doctor, is there some way of finding out? It keeps bothering me because how do I know I'm not subjecting myself to it again? So, but the one thing that he said is, Jaya, you're stressing yourself out. Don't get your BP up just thinking about what caused it. So he said, just switch off your mind, take care, whatever precautions karna hai, wo follow karte raho. But the biggest thing that I went through, to be very honest, is, um, you know, like I told you, there were no support groups. There were no experiences being shared out there back then in 2009. This is what I'm talking about. Things are far better now. You have a lot of information at the click of a button. But this lack of information, this confusion around the whole process, what is the success rate? Should I go in for it? Is dialysis better for me? Is hemodialysis better? Should I go in for a peritoneal dialysis? Such huge major decisions at that point in time. And every time I used to read up on the net, I used to get all the negative news and I used to feel very disturbed and bogged down with that. So I feel at such times it's always good to have a buddy. Could be one of your family members or a friend or a well wisher or someone who's very close to you, who can read up these things in a very objective manner and hold your hands and take you through the process, because you're dealing with hajar things. I mean, every day I was dealing with something new, some new thing was happening in my body. कभी पोटेशियम कंट्रोल में नहीं आ रहा था, तो कभी फॉस्फोरस कंट्रोल में नहीं आ रहा था, तो ये नया चालू करो, वो नया चालू करो. It was tough. It was tough because I remember every other day I used to be at the doctor's clinic waiting for hours on end to meet and to share this, and not knowing whether is this serious or not. Should I be paying attention to it? Should I be ignoring it? It was a nightmarish thing. Like I shared with you, my daughter was just about 5.5 at that time. So, uh, you know, being a mother, obviously, there are these questions that, who will pack her dabba in the morning? I'm not able to do all of those things now. Who will take care of her? Will I be there to watch her grow up? So all these things really bothered me a lot, and I don't think I did not reach out to any counselor at that point in time. Um, I didn't even speak to anybody. I think I was pretty much keeping it to myself.
Yeah,
Like I told you, if we had a support group, that would have made a lot of difference.
absolutely.
Um, Also, this decision around, should I take the kidney from my mother? She is more than happy to give, but what if something happens to her? Can I live with that? So there's not much information on the quality of life of a donor post transplant, especially India based. So we really need more data, more statistics, more research to be done, and this is something that we're taking it up at our end. But in general, I would say that to the transplant clinicians and transplant community, please put more data out there. It's very helpful for people, lay persons like us, to understand the process and understand the outcome, feel more confident about it. So broadly, I think these were the critical points. But after I had the transplant, the first question, the minute I got my hosh back, I came to my senses. The first question I asked the doctor, somebody who was standing up, and I just opened my eyes and asked, "How is mommy?" And they said, "Your mommy is doing well." And she was in wheeled in right next to me. I could see her. She was awake, though in a lot of pain, but she was awake, and I was so relieved. So I can never forget this lifelong. So some things which just stay, but there was a lot of confusion. I would say primarily because of lack of information out there. So I think we need to work around this lack of information, lack of channels for support group, data exchange, knowledge exchange. Things are far better now, I feel.
Absolutely. And you are right, like I think in when I was diagnosed with type 1, I think my parents were, like they were obsessed with finding the reason, like why, like what happened, what did we do wrong? And I think this is the case with a lot of, like parents or even like the person who's actually living with that condition, that they want to find the reason. And for me also, I was like, oh, maybe, like, like I should find something. And it
Mm,
took me a long time, to rather than focusing on what caused it, to focus on the next steps ahead. Like it has taken a lot of like mental work, and like, just to shove that question like completely out of sight. So I think that is one thing that we should always do, is like focus on the next steps, क्योंकि अभी जो हो गया वो हो गया, like
true.
वो क्यों हुआ वो जान के, it's not going to do much help other than just stress you out. So what you can do next, I think that's very important for everyone. And because there's a lot of, like a mental confusion, there's a lot of chaos, there's a lot of vulnerability, we understand, like that, because obviously with diabetes and, like any transplant, it's very tough. And like Jaya highlighted, I think as the person who is living with that condition and like undergoing that thousand questions in your head, it can become very difficult. So just take it one step at a time. Like take support from your friends or your family, or join some support groups, communities. Like there's a lot of power in, like shared experiences. When you just listen, when you're in the company of someone who's been through the same thing as you are, and you listen to their stories, I think for me, it's been a boon, like just to have like a community out there. The subconscious mind shift that it does, like just to be okay, because we know it's not going anywhere, like especially type 1 diabetes, we know it's lifelong. I'm very vocal about it, like always take support of whoever is around, like your friends, family, support group, community. Don't feel shy, because like you have to live with it lifelong, so just be ready for that. Okay, I think we talked a lot about your journey, and Jaya, thank you so much for highlighting it so beautifully and like explaining it in such easier language. And we'll go ahead and talk a little bit about like some myths or misconceptions which are usually there, and this unsolicited advice that we talked about. So what, like, because you work a lot in this area, so what are the common myths that you have come across, like which you feel like you really need to address?
So, see, remember that. So, just to give a precursor to this, imagine if we were a country where all of us donated our organs when we are no more, when we don't need them anymore, and give it to somebody else who was in dire need. There would be no waiting list. I know this is ideal situation, utopia, but just thinking that, yeah, this it could be one of my loved one, or I could be a person who is waiting. When we think like that yes, ये मेरे साथ भी हो सकता है, I think our mind opens up. So जो भी mind में doubt हो, but if we start thinking that if this were to happen to me or my loved one, how would I look at it? And then automatically the mind opens up. All myths are overcome, everything is overcome. So this is the first premise that I'd like to start with, and also to share with you that organ donation, unfortunately, is a space that is also mired in negativity at times, not all the times, fortunately. We hear about scams happening, we hear about organ trafficking happening. But remember that all of us have a role to play. All of us, each and every one of us, has a role to play in eliminating this. How? All of these scams happen when somebody who is in need of funds, somebody who's poor, is really being exploited. Therefore, if all of us were to donate our organs after we are no more, then there would be no need availability imbalance. Imagine if I get registered for a kidney in the morning and by evening I'm allotted a kidney. There would be no black market, there would be no reason for any organ trafficking or any scamming. Therefore, we at Mohan Foundation, we look at deceased organ donation, that's organ donation after death, as a sustainable way for the organ donation program to grow. Because organ transplant can only happen when there is organ donation happening. And this organ donation must be in a sustainable manner. And to be very honest, we should not be subjecting an otherwise living, healthy person, the donor, the living donor, putting them through these surgeries, and they donate. So a living donor, a living person can donate one of their kidneys as well as a part of the liver. So these are the two organs that can be donated by living donor. But imagine if the waiting list were literally non-existent and everybody got an organ. So this is the ideal thing. But ये ऐसे नहीं हो रहा because there's a lot of lack of awareness. Like people come and tell me, even people open-minded, like Snail, let me ask you, did you think of organ donation before this?
Not
Have you
really.
thought of it?
No.
No. So a lot of us haven't really even given it a thought. ऐसे भी एक चीज होती है करके पता ही नहीं है. So there's a lot of awareness that is required, awareness around the processes. Because even if I've heard of it, if I don't know much about it, why would I pledge my organs? My organs are my biggest asset. M- Money can be beyond house, money, real estate ke beyond organs. My body is my biggest asset, right? So the thing is that we have never thought about this, but remember that it is each and every person's right how this asset, the biggest asset, that is my body and my organs, should be treated after I am no more. This is my right. I must be deciding on it. I must inform my loved ones, either through a living will or taking a pledge, okay, or just a discussion at home and
Yeah.
sharing your wish with your loved ones. This is very important, but it's not happening primarily because lack of awareness. And because there is no complete information, there are a lot of myths that float around. There's fear, general. So also India has this public healthcare setup and the private healthcare setup. And like it or not, private healthcare setups are extremely expensive. Like I know a couple of my relatives, even my mom is like, I don't want to go to the hospital at all. If I go there, then I'll end up spending lakhs of rupees. So this is the mindset. So obviously people are afraid of whenever the doctor suggests something, you're always thinking extra, कि कुछ इसमें
Yeah.
कुछ इनका इरादा क्या है करके.
Right.
So a lot of mistrust in the healthcare system. So myths are caused by these things: a, lack of awareness; b, mistrust in the healthcare systems. So, like for example, the commonest problem issue that we face is, um, I don't want the body to be defiled.
Yeah.
हम जैसे आए थे वैसे दे देना चाहिए हमें. Okay, but the problem with this is, um, if while we are alive, a knee has gone bad, then we are happy to open up the knee and get a surgery done. If somebody's heart valve is not functioning, they are okay with putting a heart valve, replacing it. They are okay with getting an angioplasty. So you are okay with surgeries which will help prolong your life, but you're not okay with opening the body to donate an organ. How is that sitting in the mind? So if you're okay to prolong your life and undergo surgery when you're alive, then you should be okay with opening up your body and donating it, donating the organs. So if me or my loved one were to undergo failure of any of the organs, if I'm okay to receive, then I'm also okay to give.
Yeah.
So these are some of the myths. Very common myths is this one, that I don't want the body to be opened up. I want to give it back
Yeah.
intact. Some of them also feel that no, it's too much of a tedious process. We just want the body to be handed over immediately after the person is no more. The third very important thing is that the families are in a lot of confusion. Now, remember that death is of two types. One is circulatory death or the cardiac death, where we, check whether the heart is beating, pulses check करते हैं, heartbeat check करते हैं, breathing हो रहा है क्या. Then we always generally think, okay, now this person is no more because the heart has stopped beating. There's another type of death called as brain death. Now, in this brain death, the organs are still beating, but the brain is gone, and it's permanent death. Okay, so these happen in case of road traffic accidents where there's brain injury and or stroke or brain hemorrhage. Such conditions, the person is taken into the hospital, kept in the ICU because they're not able to breathe by themselves, because there's something called as a brain stem. So brainstem is something that is at the back of the neck. The cortex and the brainstem, these form part of the brain, and this part, the brainstem, is a very delicate and important part because it controls our um, the all the subconscious actions like breathing, the involuntary actions like breathing, digestion, excretion, जो अंदर अपने कंट्रोल के बियॉन्ड चलते रहता है, वो ब्रेन स्टेम कंट्रोल करता है. And the cortex is the one that controls all the conscious actions, like I'm talking to you, I'm waving my hand, all of this. Now, if only the cortex is damaged, then perhaps only some of the functions of my body are affected. But I am breathing, I'm alive, I'm fine otherwise. So, if a major damage happens in the cortex, the person may go into coma. But coma, the person is still alive. Okay. But in case of brain stem injury and it becomes grievous, then the person may become brain dead. And in this situation, in this within the ICU, the person is then put on a ventilator, and because of ventilator, there's artificial respiration, and because of that, the heart is still pumping. If the heart is still pumping, then the blood circulation is still going on. If the blood circulation is going on, then the organs are healthy. So it's a very unique type of a death.
Yeah.
Probability is lesser for brainstem death. But in India, as of now, only somebody who has suffered brainstem death can donate organs because the organs remain healthy even though the patient is no more. Now, in this situation, the family is approached. Now imagine if the family has never heard about all of this. ब्रेन डेथ क्या होता है पता नहीं है, डॉक्टर कुछ बोल रहे थे, कुछ तो ब्रेन डेथ बोल रहे थे, लेकिन हम तो भगवान से प्रार्थना कर रहे हैं कि वो वापस जिंदा हो जाए। ओके या वो उस सिचुएशन से रिकवर हो जाए, because they are watching that their loved one's heart is still beating, the
Yeah.
chest is still going up and down, the person is still breathing, body is still warm. So brain death is not an easy concept for people to understand, but it is legally recognized as a type of death. And only in this brain death unique situation the organs can be donated to somebody else who is in need. तो जो वेटिंग लिस्ट पे है ना, उनको ये सारे ये ब्रेन डेड व्यक्ति के ऑर्गन्स दिए जाते हैं. Only then it can save those people's lives. So I just wanted to tell you that not hardly people are aware about this concept of brain death. And now in the hospital, if the doctors approach these family members and tell them, "I'm sorry, your loved one is brain dead, is no more. Would you consider donating their organs?" If they've never heard about brain death, then imagine how negatively they will react. They will absolutely go into denial mode. They will shut off. They will not want to talk to the doctors or nurses, or they will go aggressive and think that the doctors and the hospital is doing something wrong. So this is the biggest challenge we are facing today: lack of awareness. And I wish more people were aware of these things. So please make sure that you're aware of these things. Yes, you can play an important role अपने ऑफिस में, अपने सर्कल्स में, अपने बिल्डिंग के सोसाइटीज में, कम्युनिटीज में. Please help us raise awareness about this, so people should know that I have a right, that I'm not exercising today when I don't take a decision. And small things we do, like life insurance लेते हैं. Why do we take life insurance? To secure our family when we are no more. So if somebody tells me, Jaya, ye death, this concept of death, it's very morbid and we don't want to bring it up with loved ones. लेकिन life insurance तो हम सब लेते हैं. Isn't it a morbid topic, Talking of planning that after my death, I'm going to secure my family. Isn't this an extension to that? So don't, cross those barriers internally, and really give it a good thought for yourself, because it's your individual decision, and of course it's up to you to take your family along. And the whole idea should be to normalize the conversation. घर घर में ये knowledge होना चाहिए, and decision is an individual decision, of course.
Absolutely. I think it's important to, like you said, have these discussions, normalize these discussions around, like, because people just think it's taboo, like, don't talk about this. But at that point, like, when like you said, when the families are approached and there's a lot of confusion and then they don't want to do anything, and a lot of negativity around organ donation as well. So I think with this video, I hope we are able to, kind of throw some light and change your perspective and, like, push forward on those conversations and create more awareness around that. And there any other advice you want to share with anyone who's in this situation, or like, who's looking forward for an organ transplant?
So, for people who are considering an organ transplant, there are a lot of myths floating around organ transplant. लोग सोचते हैं कि अरे जिंदगी भर मास्क पहनना पड़ेगा क्या, जिंदगी भर एसी में रहना पड़ेगा क्या. Nothing doing. See, only in crowded places we wear a mask. Hospital में जाते हैं because there are a lot of sick people around you. So other than that, you don't need that. You lead a very normal life. Medications हाँ लेने पड़ते हैं, but it becomes part of life. Not such a big deal. You can lead an absolute normal life. So, if you still have any doubts, please do reach out to us. We're happy to add you in our support group. It's free of cost, and be a part of it. Interact with others who've been through similar journeys. So, this is one thing that you can do. Secondly, if you want to know more about the process of transplant or organ donation, do reach out to us on the toll free helpline number. We have counselors who will specially guide you. It's a pan India network, and it's a 24/7 helpline.
Helpline.
So do feel free to reach out. For the people who wish to think about organ donation for themselves, you can take the pledge. Go on our website, mohanfoundation.org. You have the button where it says pledge your organs. It's a very simple form, takes not more than 1.5 to 2 minutes to fill it out. Everything is we follow the strictest privacy and confidentiality. So it's nothing is manually handled. Your information goes onto the registry, and automatically you get a donor card instantaneously. It gets emailed to you, printed, laminated, just like a driving license, the size of a driving license or a visiting card. Most importantly, show this to your loved ones, because it's more of an instrument. It's for breaking the ice with your loved ones. People may come back and say, शुभ शुभ बात करो, ये ऐसे सब बातें मत करो please. But no, it's your wish. It's don't give up. It's your right to decide how your body should be treated. And many of us think कि 60 साल होने के बाद देखता हूँ, but death is something that can happen. I mean, I would wish that each and every one of us live healthy life till 100 at least, but this is something that is not in any of our hands. So we do plan about how life insurance planning karte hain. We also think about leaving behind a will. So all of this should be part of that prudent decision making. Um, and I would also like to say, the remember the ABCD of organ donation. Anybody can donate. A for anybody can donate. Okay, why? Because even if you have diabetes, even if you have hypertension, even if you have thyroid, even if you anyone's had an eye surgery, doesn't matter. Today, if it is your wish to donate your organs, go ahead, make a living wish, sign up for the donor card, show it to your loved ones. It has a toll free helpline number. We've had people who signed up 15 years ago, and now the relatives reach out saying that our loved one signed up with you, so now please tell us how to go about this. Please also know that a lot of these things are time bound. So ask the family members to reach out to us immediately, because if it is cardiac death घर पे हो गई है तो घर पे भी eyes and skin donate हो सकते हैं. So reach out at the earliest. We always request that within an hour or two people should reach out to us, because within 6 hours the tissues must be donated. Tissues like cornea, skin, all of these must be donated within 6 hours. If it's brain death, brain death of course is a more difficult concept to understand. So tell your loved ones about it. या आपने आज कुछ तो नया सुना, so that they are also familiar with it. Tie up with us, reach out to us. We're more than happy to collaborate with you to raise awareness. You can become our organ donation ambassador as well. So A, anybody can donate. B, brain death. Only a brain dead person can donate organs. So get familiar with this concept of brain death. C, conversations. या चर्चा घर पे जाके please have these conversations. Let's normalize these conversations. And D, दान or donate. In India, I think we are the most giving people. We've been taught to give, we've been taught to donate. So, donation is not something new to us. Organ donation may be a new concept, but get familiar with it, think about it, and endorse it. That's all.
Thank you. Thank you so much, Jaya. And thank you to everyone who joined us. It's been a very insightful, very a new kind of a workshop that we have done here. And you can always reach out to this video again. It will be saved on all our social media platforms. And also for further information, you can reach out to Mohan Foundation. We have shared the details in the comments here, and details will also be available on all the social media handles as well. And thank you, Jaya, for taking the Sunday out and talking with us and sharing all this insightful information with our community here. Thank you so much.
Thank you.
And for everyone here, thank you for joining us. We hope this session was helpful to you all. And take note of the ABCD that we spoke about. And we'll see you again next Sunday at the same time with another workshop. Thank you so much. Bye bye.
Bye bye.